Hello, guys! Have you ever wondered whether supplements truly improve erections, libido, or overall sexual function, or whether most of what you hear is simply marketing and expectation? This is an important question, especially as men age and notice changes in performance, desire, or confidence. Sexual health is complex, and while supplements are often presented as simple solutions, the reality is more nuanced. One of the first things that must be understood is the powerful role of expectation. In sexual health research, placebo responses are remarkably strong. When people believe something will improve their erections or libido, a significant percentage actually experience improvement, even when the substance itself has no active ingredient. This does not mean people are imagining results. It means the brain plays a central role in sexual function. This is precisely why well-designed studies are essential. Without comparing a supplement to a placebo, it is impossible to know whether the effect is biological or psychological. When it comes to erections, the key physiological factor is blood flow. Erections depend on the ability of blood vessels to relax and allow blood to enter penile tissue. This process is driven by nitric oxide, a signaling molecule released by nerves and blood vessels in response to arousal. Anything that meaningfully increases nitric oxide availability can theoretically support erectile function. One supplement that has been studied extensively in this context is an amino acid involved in nitric oxide production. The body uses this amino acid as a building block to generate nitric oxide. Some studies show modest improvement in erection quality, particularly in men with mild erectile dysfunction. However, this compound breaks down quickly in the body and often requires multiple daily doses, which can make consistent use difficult. A related compound converts into the same amino acid but remains in the body longer. While research on it is less extensive, it is more bioavailable and easier to take consistently. For men with mild to moderate erectile changes, this approach may provide subtle improvement. However, it is important to be clear. Supplements do not reverse severe erectile dysfunction. They do not replace medical evaluation, and they do not override significant vascular disease, nerve damage, or hormonal deficiency. Semen volume is another area surrounded by misunderstanding. Many supplements marketed for this purpose focus on sperm quality rather than fluid volume. In reality, sperm cells make up only a small fraction of semen. Increasing sperm count does not necessarily increase ejaculate volume. The most reliable factors affecting volume are hydration and frequency. Adequate fluid intake supports fluid production, while longer intervals between ejaculations allow volume to build naturally. Certain medications and medical conditions can also affect ejaculate volume by altering how semen exits the body. In some cases, semen may flow backward into the bladder rather than outward. Addressing underlying medical issues or medication side effects is often more effective than using supplements. Libido is even more complex than erections. Desire is influenced by hormones, mental health, sleep, stress, relationship dynamics, and overall well-being. Testosterone plays a role, but it is only one piece of the puzzle. Many supplements claim to boost testosterone, yet most show minimal or inconsistent effects in research. Even when testosterone increases slightly, the change is often too small to produce noticeable improvements in desire. Lifestyle factors consistently show stronger effects than supplements. Poor sleep alone can significantly reduce testosterone levels. Chronic stress suppresses sexual desire through hormonal and nervous system pathways. Diets low in nutrients or excessively processed foods can interfere with hormone regulation. Resistance training, especially involving large muscle groups, has been shown to support healthy testosterone levels more reliably than most supplements. Environmental exposure also matters. Certain chemicals found in plastics and food packaging can interfere with hormone signaling. Reducing exposure by avoiding heating food in plastic containers and using safer storage options may help support long-term hormonal balance. Sexual health is not only about erections and libido. Many men face concerns related to urinary control, especially after prostate surgery. This occurs because the prostate plays a role in urinary sphincter control. After surgery, leakage during coughing, lifting, or movement is common. For most men, this improves over time as muscles adapt. Strengthening the pelvic floor can significantly improve control, particularly when guided by trained professionals. Pelvic floor awareness is unfamiliar to many men, yet these muscles are essential for both urinary control and sexual function. Learning how to activate and relax them properly can improve confidence, reduce leakage, and enhance overall function. In cases where conservative approaches are insufficient, medical interventions exist, but education and muscle training remain the foundation. Urinary tract infections are another common concern, especially with aging and hormonal changes. True infections are characterized by symptoms such as pain, burning, urgency, or discomfort. The presence of bacteria without symptoms does not always require treatment. Overuse of antibiotics in such cases can increase resistance and create long-term problems. Recurrent infections often have identifiable contributing factors. Dehydration concentrates urine and encourages bacterial growth. Constipation puts pressure on the bladder and interferes with normal emptying. Hormonal changes, particularly reduced estrogen in women, alter the vaginal and urinary environment in ways that increase infection risk. Addressing these factors often reduces recurrence significantly. Complete bladder emptying is another overlooked issue. Residual urine provides a breeding ground for bacteria. Taking time during urination, relaxing, and allowing full emptying can make a meaningful difference. When infections persist despite lifestyle changes, specialist evaluation is appropriate. What ties all of these topics together is a simple truth. Sexual and urinary health are deeply interconnected with overall health. There is rarely a single solution. Supplements may play a small supportive role for some people, but they are never a substitute for sleep, stress management, movement, hydration, and medical evaluation when needed. The most effective approach is informed, balanced, and realistic. Understanding how the body works allows better decisions and reduces fear. When expectations are grounded in evidence rather than marketing, outcomes improve. Taking care of sexual health is not about chasing perfection. It's about maintaining function, comfort, and confidence over time. And that is something everyone deserves. And this is where many people finally begin to see the bigger picture. Sexual health does not exist in isolation. It is not a switch that turns on or off based on one pill, one supplement, or one technique. It is the result of how the nervous system, blood vessels, hormones, muscles, emotions, and habits interact over time. When one area is neglected, others compensate until symptoms appear. When all areas are supported together, improvement becomes not only possible, but sustainable. One of the biggest mistakes people make is expecting immediate transformation. The body does not respond well to urgency or panic. In fact, urgency is one of the strongest inhibitors of sexual function. The nervous system interprets urgency as threat. Threat activates protective responses. Protective responses reduce desire, blood flow, and sensitivity. This is why patience is not just a mindset, but a biological requirement for improvement. Let us return briefly to erections and libido, because these are often the first concerns that motivate people to seek answers. Erections depend on healthy blood vessels, intact nerve signaling, and a calm, responsive nervous system. Libido depends on hormonal balance, emotional safety, mental clarity, and physical energy. When someone focuses only on the erection itself, they miss the systems that support it. For example, chronic inflammation in the body stiffens blood vessels. This reduces their ability to expand. Poor sleep increases inflammatory markers. Excess sugar intake increases inflammation. Sedentary behavior worsens circulation. Stress hormones constrict blood vessels. All of these factors quietly interfere with erectile function long before a person notices symptoms. This is why interventions that improve overall vascular health often improve sexual function as a secondary benefit. Regular movement improves endothelial function. Balanced nutrition supports nitric oxide production naturally. Stress reduction allows blood vessels to relax. Sleep restores hormonal rhythms. None of these are exciting solutions, but they are powerful. Libido, in particular, is extremely sensitive to mental load. People who are constantly overstimulated, overworked, or emotionally drained often notice reduced desire. This is not a failure of attraction or masculinity. It is the nervous system protecting itself from overload. Desire returns when the system feels safe, rested, and resourced. Another area that deserves more attention is pelvic floor health. Pelvic floor muscles play a role in erections, ejaculation, orgasm, and urinary control. Many people are unaware of these muscles until something goes wrong. strong. Chronic tension in the pelvic floor, often caused by stress or poor posture, can reduce blood flow and sensitivity. Weakness can reduce control. Learning to both strengthen and relax these muscles improves function more reliably than most supplements. Urinary symptoms also deserve careful understanding. Leakage, urgency, or infections are often treated as separate problems, but they frequently share root causes. Incomplete bladder emptying, constipation, dehydration, and pelvic floor dysfunction can all contribute. Addressing these factors reduces symptoms without invasive intervention in many cases. Recurrent urinary tract infections, for example, are rarely caused by one single issue. They often reflect a combination of hydration habits, bowel health, hormonal changes, and bladder mechanics. Treating only the infection without addressing these contributors leads to recurrence. Understanding the system breaks the cycle. Another important but often ignored factor is shame. Shame prevents people from asking questions. Shame prevents early intervention. Shame creates isolation. When health concerns are hidden, they grow. When they are discussed openly and calmly, they become manageable. This applies to sexual health more than almost any other area. Education replaces shame with clarity. Clarity replaces fear with choice. Choice restores agency. When people understand what is happening in their bodies, they stop blaming themselves. They start working with their bodies instead of against them. It is also important to recognize that aging is not synonymous with decline. Aging changes physiology, but it does not eliminate capacity for pleasure, intimacy, or connection. Many people experience their most fulfilling sexual lives later in life, once pressure decreases and communication improves. Supporting the body through aging requires adaptation, not resistance. This includes adapting expectations. Sexual function may look different over time, but different does not mean worse. Slower arousal can mean deeper sensation. Longer foreplay can increase connection. Less urgency can improve control. When people stop measuring themselves against unrealistic standards, satisfaction often increases. Supplements, when used, should be viewed as supportive tools, not solutions. Their effects are subtle and context-dependent. Without foundational habits, they do very little. With strong foundations, they may add incremental benefit. This perspective prevents disappointment and misuse. Medical evaluation is also important when symptoms persist or worsen. There is no virtue in avoiding care. Many conditions are treatable when addressed early. Delaying evaluation due to fear or embarrassment often complicates treatment later. Seeking help is not weakness, it is responsibility. Ultimately, sexual health is part of whole person health. It reflects how well the body is supported physically and how safe the mind feels emotionally. Improving it is rarely about doing more. It is usually about doing things differently, more gently, and more consistently. If there is one takeaway from this entire discussion, it is this: sustainable improvement comes from understanding systems, not chasing quick fixes. When you support the system, symptoms follow. Taking care of yourself is not indulgent. It is necessary, and it is never too late to start.